And
Okay.
Sydney, as you
Yeah.
do that, can you let folks know how they can pin both Tanya and myself so that they can see both of our presentations, for lack of a better
Yes.
word?
I think you would be the only two people on camera. Nobody
Okay.
else is able to be on camera. And so I don't think that's a problem, but so I believe to pin, oh, oops, sorry there. To pin, you go to the top right corner of the image of both Andrea and Tanya, and you click on the three dots there. And pin is option about halfway down. And that will keep Andrea and Tanya focused. But I think since we have everybody off camera, I think that should be fine.
Okay, great.
And
So
let me just make sure. Okay, so looks like your slides are looking good there. And do you have any questions? I guess I just want to welcome you both
thank
before
you.
I hand things over to you, and I'll be hopping off camera as well. But I just want to thank you, Andrea, from Public Health Ontario, coming to lead us through some discussion on health promotion. And really glad that you brought Tanya with you, that the both of you are here. And I'll let you introduce yourself further. So unless there's anything else you need from me.
I think we are good, but I might, if there's an emergency, I'll holler out.
I am here, and yeah, just call my name and we'll be here to help you out.
Great, thank you.
Right, over to you.
Thank you so much. And so for those of you, I just discovered, so the way that I have my screen arranged, which I'm not sure if you see or not, but I have Tanya, I was actually able to expand her little box in the top left-hand corner of my screen. Because Tanya is going to do some beautiful graphic design work for us today to help to capture some of the main points of our session. I find health promotion extremely interesting. I've dedicated my 16-year career to it, but I also recognize that sometimes when we talk about theories and principles, it's not always that wonderful. So I'm very happy to have Tanya here with me, who will be capturing some of the key points and perhaps even some of our discussions. So like Sydney mentioned, my name is Andrea Bodkin, and I work at the Provincial Public Health Association, Public Health Ontario, which pre-pandemic, chances are very few of you had actually heard from, but many of you might be more familiar with our work at this particular point in time. And as I mentioned, I've been working in health promotion for about 16 years. And find it one of the most fascinating topics. So we'll dive into our presentation very shortly, but before we do, Tanya, would you like to say hello and tell us about you?
Sure, terrific. Thanks for having me. My name's Tanya Gerber, and I'm a graphic reporter and graphic facilitator, and I'll be jotting down some of the main themes of today's conversation and look forward to sharing the images that I create, and hopefully you'll be able to see them okay and see them come to life throughout the session. It's very nice to be here, so thank you.
Thank you for being here. So Tanya and I had been talking, I don't know, this week, last week, something like that, that doing conferences is, of course, Tanya's bread and butter, and presenting at conferences is one of my very favorite things in the world. And it has been some time since we have been at a conference, so I'm just thrilled to be here. I'm also excited because I thought, oh, I'm going to wear earrings today. And then I put on my great big squishy headphones and realized you won't see my earrings, but trust me, they are there. So one other thing about me that I wanted to share with you is that I consider myself to be of white settler background. 3 of the 4 branches of my family were actually settler colonists here in Canada. And so I think a lot about the privilege that I hold these days because of my ancestors. And I often wonder about the people, the first peoples that or around my ancestors and how they were impacted by the folks that I call my great-great-grandparents and even older than that. So for that reason, I wanted to share with you that I am coming to you from Toronto, or Takaronto. I'm actually right beside the Don Valley and the beautiful Don River, which was a highway to our First Peoples here in Ontario and in Canada. And Takaronto has been the traditional territory of many First Nations, including the Anishinaabe, the Haudenosaunee, the Wendat, and most recently the Mississaugas of the New Credit. And I want to extend my gratitude for my ability to be here, to work and to live and to play on this land. So, oh, there, good. I just figured out how to advance my slide. So here's what we're going to do today. In the dreaded 1:15 Friday afternoon time slot. The bulk of the presentation, as Sydney mentioned, is going to be about health promotion. But in order to talk about health promotion, I thought it might be handy to start by talking about health. And then we're going to talk about how we can apply those health promotion principles to your work in CAPC and CPNP projects. You're going to have a couple of breakout discussions. I've already learned about you folks that you are a chatty group. And then at the end of this session, as kind of our wrap up, Tanya is actually going to present the beautiful drawing, and you can see that she has already started in the background. So like I mentioned, before we start talking about health promotion, let's talk about what I mean when we talk about health. So historically, health has often been viewed as the absence of disease. So if you were not sick, you must be healthy. It's a very binary view. And this particular view is called the biomedical model of health. Diseases such as cancer, diabetes, and obesity make us unhealthy. Genetics and family history make us sick. So there's not really anything that we can do about it. Basically, that is our particular lot in life. Another way to look at health is what we call the behavioral model, which views health as a product of behaviors and healthy habits. So if I am physically active and I eat my vegetables and fruits, I sleep well and I manage my stress, then I am going to have health. Choosing healthy behaviors make us healthy, and choosing unhealthy behaviors make us unhealthy. And the word that I want to underline, figuratively speaking, there is choice, is that it is our choices that make us healthy or unhealthy. So a new definition of health was published by the World Health Organization. And I say new definition, even though it was published in 1948, which is not exactly new, but in the post-war period, the WHO defined health as this. Health is a state of complete physical, social, and mental well-being, and not just the absence of disease or of infirmity. Health is a resource for everyday life, not the object of living. It's a positive concept emphasizing social and personal resources as well as physical capability. So this particular definition of health views health as the product of social, economic, and environmental determinants. And this is called the socio-environmental model of health. So rather than seeing health as something that we can choose to have or something that we inherit, this particular model of health views health as coming from factors such as poverty, unemployment, isolation, and the things such as policy and community mobilization and advocacy can actually help to improve the health of the population. So in other words, with this model, well, we can start to understand the causes of the health issues in ourselves, in our communities, in our province, in our country, and in our world. And only when we start to understand that can we start to address the causes of poor health. So we've got our first poll question of the day. I'm super excited about it. So my question to you is, which of these three models tend to impact your work the most. So in other words, as you in your CAPC and CPNP projects are doing your work at the community level, how do you view health? How do your colleagues view health? How do the folks in your communities view health? So Sydney, or one of the Zoom elves, is going to put up a little poll question just to get a sense of what impacts you here.
Okay, I can launch that right now. Hopefully everybody is seeing it.
I think it looks good. So again, the three models: biomedical, behavioral, and socio-environmental. And I think a lot of this is kind of, what is the word? It sort of shifts through time. You know, when back in the 70s and 80s, health was really seen as a choice in terms of your behaviors. But now I think we're really starting to realize even more over the course of this pandemic what actually impacts our health. So this is very curious. So most of you, it looks like the socio-environmental with a good portion of behavioral model, and then a few folks in the biomedical model. That's super interesting.
So we've got about 85. Oh, have you've okay.
Oh,
great.
I did. No, is that okay? I just
is
clicked
okay.
on
I was going to check in with you. Do you want me to share the results?
I think I did. Did I?
I think you are. Okay.
I think I am. Wow, look at me go. Okay. So do I just close the poll now, Sydney?
I think we just click the X.
Oh, wonderful. So I have to confess to you all this is actually my first conference presenting over Zoom. So I'm just figuring out all of this wonderful stuff.
Awesome.
Okay, thank you. So it really looks like most of you understand already, as I knew that you would, because anyone who works with families and kids have an implicit understanding of what makes us healthy and what can contribute to us being unhealthy. And I love when we think about this here to think about the iceberg model. And I think it's a perfect image because you can see a third-ish of the iceberg on top of the water, but under that water line are all the things that you can't necessarily see. So we can't necessarily see that people are affected by income and social status, or they are affected by racism and colonization, or early childhood experiences, or gender, or culture, or any of these other factors. And these are the causes of the causes, or sometimes we say the causes of the causes of the causes of health. And we call them the social determinants of health, which may be a term that you have heard of before. But even if you haven't heard that term, you know from supporting families and supporting communities that these are the things that really impact health. And in Canada, 50% of our health is determined by these determinants. Only about 25% of our health status is determined by our access to healthcare. We are fortunate to have socialized medicine in this country. And then about 25% of our health is determined by our genetics. So if you think again about those different models of health, about 50% of our health is actually impacted by these factors, these social determinants of health. It's also important to mention that different groups of people might have different determinants of health. And so I wanted to share a wonderful model of determinants of Indigenous health, is because we know that Indigenous communities have additional and unique layers of factors that impact health. And so the determinants of Indigenous health, and this is a Canadian model, are grouped within 3 levels. So the first level are proximal determinants. So these are surface level factors. You can think about these being on top of the water line if you're thinking about that image of an iceberg. So these are things like our access to healthcare, the physical environment in which we learn, which we live, and health behavior. Here's those behavior pieces again. That's interesting. It's part of the surface level risk factors or surface level factors. The next layer down, so maybe just underneath the waterline, are the intermediate determinants. So these are things that are underlying some of the things in the proximal category. So these are things like community infrastructure and relationships, kinships, networks, and knowledge sharing. And then at the very bottom of that iceberg, these are the really important ones. These are the structural determinants that basically impact everything else going up to the top of that iceberg. And these are things at the root causes of how Indigenous health is manifested, and includes things like historical facts, political, ideological, economic, social foundations and systems. So this is where we see the impacts of colonization, the Indian Act, residential schools, the 60s scoop, systemic racism, and things that are still even going on today in First Nations, Inuit and Métis communities in Ontario and in Canada. What's also really important about this model is that it doesn't just talk about the risks to poor health, it also talks about the things that determine good health. So Indigenous worldviews, spirituality, resilience, self-determination, connection to the land, culture, and language. So that's what I find very interesting about the determinants of Indigenous health. It's not just a list of things that impact poor health or could make you have poor health. It's things that actually protect you from poor health, even as there are others that cause poor health. Okay, so now that I've talked a little bit about health, and I've talked a little bit about what can cause health, both poor health and good health, now I'm going to dive into one of my favorite subjects. What is health promotion? And the reason that I wanted to spend some time talking about health and what causes or prevents people from being healthy is that that is really the foundational layer of health promotion. Health promotion really emerged from the socio-environmental view of health, as well as acknowledging the determinants of health and what helps people be healthy or what can cause poor health. So here's something very cool we can be proud of in Canada, is something called the Ottawa Charter. So in 1986, the World Health Organization convened the very first convention on health promotion. And at the end of that convention, the people who attended wrote down and drafted a charter, which we call the Ottawa Charter because that convention happened to be in Ottawa, Ontario, in Canada. And the charter was developed to try to identify how we could take action to achieve health for all by the year 2000. So, oops, here we are in 2021. And even though this document is from 1986, it still really provides the foundation for health promotion. And here is a slightly wordy definition for you. So health promotion is the process of enabling people to increase control over and to improve their health. So what's really important about that sentence is that health promotion isn't something that you do to people or even something that you do with people. In health promotion interventions and approaches, what we're trying to do is give people the tools and the confidence and the skills to take control of their health. And not just their health as individuals, but their health as communities or as a group of people or as people who live in a province or in a country. So the definition goes on to say, to reach a state of complete physical, mental, and social well-being, an individual or a group must be able to identify and realize aspirations to satisfy needs and to change or cope with the environment. So it's not just the sense that health is something that you achieve once. There's really, I love the word aspiration. You know, there's something very aspirational about this part of the definition. So health, therefore, is seen as a resource for everyday life, not the objective of living. It's a positive concept that emphasizes social and personal resources as well as physical capacities. So therefore, health promotion isn't just the responsibility of the health sector, but it goes beyond healthy lifestyles to well-being. Health promotion is not just the responsibility of the health sector, but goes beyond healthy lifestyles to well-being. And this is really important because some of you might be sitting here thinking, okay, I'm a social worker, I'm a public health nurse, I'm a family facilitator, I work in early childhood. Why is Sydney making me sit through this presentation about health promotion? And this is why. Health is the responsibility of everyone, of every sector, of every department or aspect of government, because all of those things impact health, like I talked about before with the social determinants. And what's really important here is that when we are working to improve health, as you all are, we're working to improve the health of the kids and the families and the communities that you support, it's important that we work with a whole variety of different people. So that segues into our first discussion session. And in case you're wondering why there's a disco ball, my short form for discussion is always disco. So here is our first breakout disco. What sectors influence our health? So Sydney and the Zoom elves are going to put us all into some small groups of somewhere around 4 or 5 people. You're going to have, I can't remember what I said, Sydney, but 10-ish or so minutes just to talk about what sectors influence our health. So when you think about sectors, because that can sometimes be a little bit of a jargony word, you could think about like, what are all the different government departments, for example, or who are all the people that I work with in my local communities to support kids and families? Who are all those people that can influence the health of the kids and the families that I work with? And I find often when we talk about working with people in different sectors, we sometimes think about the usual suspects, and I've got great big quotes around usual suspects. We often have people that we work with a lot. So for example, some of you may work quite a lot with your local public health unit, or maybe you work with different social service agencies in your community. Who don't you work with that impacts health? Think a little bit about those unusual suspects. So I'm going to stop talking. I'm also going to take a peekaboo at the chat, and Sydney is going to break us out into some groups, have a great discussion about the sectors that influence the health of the kids and families that you work with, and we'll come back together soon.
Sounds great, Andrea. I'm about to hit go. And I did see a request about putting somebody together. I will do my best, Sarah, but I can't promise, but I will try.
Oh, and I also just, while I'm looking at the chat, Sydney, I'll just mention that I won't be sharing the slides, but I did send a handout to Sydney that has the content of my slides. You don't want my slides. As you've already seen, there's very little on them. So I prepared a beautiful handout for you. So that will be circulated.
Thanks for the reminder. As soon as when we come back from the chat, I'll put the link to your handout in the chat. So,
great.
Okay.
Have a great conversation.
Okay, so you should be getting an invite to go to a room.
Sydney, can you not put me in a room? It might be too late. I might just leave and come back to the big room. Never mind.
You do have an option to say not now, don't you?
Okay, I think so. Okay.
I thought maybe as a co-host you might not be put in, but I guess you are.
Okay.
So Shelley and Sarah, can I figure that out? Shelley and Sarah. So is there anybody who is not in a room and wishes they were in a room? Okay.
Sydney, it looks like it's set up that you have to manually click in, like someone won't automatically go to a room.
Yeah,
okay,
so somebody
perfect.
who maybe is, off doing something else for a bit, that's perfectly fine. It looks like a good proportion, Andrea, are in the rooms. There's just,
Yeah,
it's like 13 people.
it looks great.
So
And the
that's
best
great.
thing is that now I get to look at Tanya's beautiful art. Look at this. That's amazing.
That. Oh.
Oh, so
So,
incredible.
Andrea, do we get a chance for Tanya to kind of take us through her process a little
Yes,
bit?
that's how we're going to do the wrap up for the workshop. So Tanya will get to actually walk us through all the different sections of her beautiful, beautiful work. Oh my gosh.
Now, do you want me to set a timer?
Did you set up the breakout room so that people would automatically join back in?
No. There would
Okay.
be a certain point where I'll close the rooms.
Oh, great. Okay. Yeah. So frankly, I can't really remember what I had sent you in the email, but I think 10 minutes is probably adequate for this discussion.
Okay. Well, I'll start from 8 minutes now.
Okay, great.
Cut them in there for a little while. Okay.
Sydney, is there a way to pause the recording just so that
Yes.
people won't? Andrea, I am seeing in the chat that participants do have the raise hand function. Just so
Great.
you know.
Super. Thank you. Okay. So now I need to figure out my own self here and get back to my slides. Okay. So welcome back, everyone. Hope you had a great discussion. I want another moment of looking at Tanya's beautiful artwork before I put my quite dull PowerPoint back on. Oh, here we go. Okay, great. So I hope you had a wonderful discussion about the different sectors, the different folks within your community that help to influence the health of the kids and the families and the communities that you support. So I kind of alluded to this earlier. Some of you may be sitting here on a beautiful sunny Friday afternoon going, why is Sydney making me listen to this presentation about health promotion? And I wanted to try to answer that question for you just a little bit. So health promotion isn't just something that, you know, I like to talk about and it's my work, and I'm super lucky that I actually have the words health promotion in my job title, which isn't always the case. But health promotion can actually provide a way for you to demonstrate the value and the impact of your work. And here is a couple of ways that that might work. First of all, your funder, Public Health Agency of Canada, is familiar with a health promotion framework and health promotion context. So you can actually think about how to demonstrate your work in a way that is familiar to your funder. And the other thing that I think is really important is to think about how health promotion actually provides us a framework to address the root causes, the causes of the causes of the causes of the causes of poor health. And while health as folks who work in CAPC and CPNP might not be your primary goal, it certainly is something that's so important to your families, your communities, and even to those of you working in this space. And so it also gives you an opportunity to think about how to plan your programs and your services from a slightly different context. So here is the real meat. Here is what I hope that you can take away from this presentation in terms of how you can apply some of these principles in your work. And I always laugh when I say about here is the meat of the presentation because I'm a vegetarian. Here is the Ottawa Charter that I mentioned, the 1986 document, and the charter that was created at the end of the first WHO conference on health promotion. Now, this is a hilarious logo because it kind of looks a little bit like a 1970s NHL logo. I didn't write that joke, I borrowed it from somebody. But it provides that framework for how can we achieve health for all. And here is a little bit about how this works. There are 5 separate but intertwined actions that are needed in health promotion. And I'm going to put bigger words up on the screen, so don't worry if you're trying desperately to read the tiny words in those little boxes. And the 5 action areas are build healthy public policy, create supportive environments, strengthen community action, develop personal skills, and reorient health services. So let's start with the first one, build healthy public policy. This is one of my favorites. I like to consider myself as a little bit of a policy wonk, or at least a policy wonk wannabe. When we talk about building healthy public policy, we are trying to put in place legislations, fiscal measures, taxation, organizational change that support health. So what are those policies that can increase income, that can build healthy neighborhoods, that can support people's and families' education? What are all of those policies that can help to do that? And what are the policies that stand in the way of that? So for example, sometimes we think of social service policies such as income replacement. So in Ontario, Ontario Works and ODSP. Sometimes we think of those as policies that are supposed to support the health of folks in our communities. We also know that the incomes in those programs are not adequate to actually provide for all of the necessities of life. So we can see that that might be a policy that might require some change in order to actually improve health. A couple of other examples are junior kindergarten in Ontario. So our little ones are getting an extra year of full day school, and our families are getting an extra year of being able to participate in the workforce. And sometimes these broad policies are seen as sort of social levelers that are supposed to give equal access to everyone, even people who may not have the opportunity. So for example, for families who might be on lower incomes that couldn't afford to send their kids to daycare, or couldn't afford for a parent to go back to work because they need to be able to stay home and take care of that child, something like junior kindergarten could be seen as a social leveler that is trying to provide that opportunity for all. Now, we also know, if we think about the determinants of health, that sometimes great big policies like that aren't an equal leveler. That's another topic of conversation. So the next category, or the next action area, is creating supportive environments. I just want to mention one more thing about policy, because a lot of the policies that I mentioned when I was talking about this are really big, you know, stuff at the provincial and the national level, and sometimes even international policies. And so some of you may be thinking, okay, that's great. What in the world can I actually influence here? But building healthy public policy can also happen at the municipal level, and it can also happen at the organizational level. So what are the policies within your own organization that could be creating more opportunities for health, or putting barriers to health in the way? So I think that's really important, because sometimes we think that policy is a little bit beyond the work that we do. Okay, back to creating supportive environments. So this action area recognizes that where we live and work and learn and play impacts our health. And so this can include the natural and the built environment. It can include the conservation of natural resources, energy production, and urbanization. So some examples here could include how a municipality zones for affordable housing and makes sure that grocery stores can be placed in communities so that we don't have a food desert. It could include public transportation or active transportation like bike lanes and sidewalks. It can include access to parks and recreation and safe parks for our kids and our families. And again, this is another one that might seem just a little bit outside of the scope about what you do. So maybe some of the things that you could consider here are actually partnering with others who actually do have influence on supportive environments, or it could be looking at the own spaces that your programs are held in, or the spaces in which the families that you support live, and thinking about how those environments can be more supportive. The next one's one of my favorites. I'm going to say this about all 5, by the way. So this one is called Strengthen Community Action. And this is the reason that I had you do that little breakout session talking about the different sectors and the different types of organizations and folks at the community ground who impact health. Because by working with all of those people, we can influence policy, we can influence supportive environments. You do not have to do all of this work yourself. You can't. Health promotion Promotion is a multi-sectoral enterprise. And by strengthening community action, you can start to accomplish more. You already know this. I'm really talking to people who already know all about this. The other thing about strengthening community action, it's not just about working with partners and organizations and governments and all of those folks. It's about working with community. And only when communities feel empowered to take ownership over programs or services or direction that we can start to see improvements in health. So the example I thought I would share here is this really fantastic group that some of you may already know of. They're called Toward Common Ground, and they are in Guelph. And it is a whole number of organizations, it's over 20 now, that have all come together to try to improve the health in their community for young kids. It's mostly geared towards families and the under sixes as well. And interestingly, the way that they're actually doing that is around data, around information, statistics, collecting surveys, because what they were finding is that it was really hard to develop programs in their area and services without having an understanding of what was actually happening in the community. So they came together and they actually create data projects, and they also do collective action as a group of organizations to try to improve health for families, kids, and communities in Guelph. And so an example of something they've done recently is they have a Vital Focus series, it is called, that provides information on how COVID-19 is affecting people in the Guelph area. So we can all kind of imagine, and we know, and we're all also affected, and your families are affected by COVID-19, but specifically in Guelph, which is their catchment area. What specifically is going on, and how can we actually address that? The fourth action area is develop personal skills. And this might sound kind of weird because I already talked about the behavior change model of health and how that view was really all about choosing healthy behaviors. And I talked about how the social determinants affect 50% of our health. That's very impactful. But personal skills are still really important. I mean, I could have beautiful, I'm just going to use a kind of a light example because I'm a cyclist, and I could have, beautiful bike lanes, and I could even have a beautiful bike, and I could have a desire to increase my physical activity levels. But if I can't actually ride the bike, it's not going to help me much. So personal skills are still important. And some examples here might be some skills around parenting or positive parenting, skills around finance and budgeting, or even something like food skills, cooking classes, grocery store tours, etc. And again, recognizing not all of these examples are within your realm of work, but just to give you some examples about what some of these things might mean. The last one's pretty fun. It's called Reorient Health Services. And this one is important because a lot of the time when people think about what makes me healthy, they think, I have a family doctor. I can go to the hospital. I can see a specialist when I need to see a specialist. And those things are important. As I talked about before, about 25% of our health can be attributed to access to healthcare. Important. What we also want to think about is, can we actually redistribute some of those services more towards health promotion rather than sickness care? So here's a great example. I love this story. So St. Michael's Hospital is in downtown Toronto, right downtown. So they see a lot of people who are impacted by sex trafficking, drug use, poverty, as well as folks who live and work in that downtown core. And they have a whole group of health promoters. They're called income security health promoters. And their job is to work with patients and clients and help them to apply for social benefits and grants. They provide credit counseling. They provide budgeting support. They help to connect people with community resources. So here is a hospital Their job is to treat people who are sick, to support people who have an injury or have a disease. And they have recognized that income is such a primary determinant of health that they have a whole team of income security health promoters to help their clients and their patients increase their incomes because they recognize that that increases their health. So these are the 5 action areas of the Ottawa Charter. And the point here isn't to say, you know, you should focus on one action area or another action area. The point here is to think about if all 5 of these action areas are necessary to improve health, how can we develop our programs, our services, our supports? How can we link with community agencies and partners so that we're actually addressing all 5 of these action areas? And this is where that link to your funding application gets really interesting, because if your funder wants to see programs in a health promotion framework, these 5 action areas are it. It might seem like you're going out on a little bit of a limb that you want to do some advocacy work for example, basic income. But with the Ottawa Charter, it actually provides you with the structure to say, actually, this is really important and this might be a good area for our work. Now, I recognize that example might not be applicable for you, but it also might be. So a little bit of food for thought for you. So we're going to move along to another disco. So here's some questions for your small group discussion, and we're going to give you a little bit more time for this one. A good 15 minutes, I think, is great. Which of the 5 of those action areas do you currently focus most of your attention on? Is it building personal skills? Is it creating a supportive environment? What action could you actually broaden into? And is there one of those actions that seems like it might be the most challenging? Is it healthy public policy? You're like, oh my gosh, my poor families, I don't even know what that would look like. So take some time in your small groups to talk about that. Do make sure that everyone has time to speak who wants to speak. Of course, you don't all have to participate. You can learn so much by listening. So we'll break out into groups and we'll be back in can we be, 15 minutes is great.
I should have checked, Andrea. Do you want, we could keep in the same groups?
I think,
or do you want to reshuffle?
I think reshuffling would be great if
we
that's
can
okay.
Do that. Yeah, absolutely. Okay, give me just a moment.
Absolutely.
Recreate. Okay. Okay, and I'm going to take a moment to see if I can, I don't know if I can make the accommodation that was asked here. Okay. Okay, you should be getting an invitation to join. And I am going to see if I can put Nikki and Tammy together. Do my best here to see if I can figure it out. Actually, if Nikki and Tammy, if you could let me know in the chat what room you're currently in, that would help. Then I know where to find you.
Tanya, you're so amazing. Oh my gosh, you're amazing.
Nikki, you're in room 2. Okay, and then Tammy
Thanks,
is
Andrea.
in room. Okay, Nikki, it looks like you're able to. Okay, Nikki, I can put you in room 7. Move to 7.
There's
Okay.
something very ego boosting about seeing your words actually being written down by somebody else. Oh,
yeah.
Amazing.
Okay, I think most people are in the rooms, Andrea, and I've got the 15 minutes on the clock.
Amazing. Sydney, that's really basically the bulk of my content. We're going to come back and do Tanya's wrap up of her beautiful artwork and then some time for questions. How are you feeling about that content? Do you feel like there's anything in particular I need to, focus in on, or is there something you were hoping that maybe I haven't talked about yet? I'm totally putting you on the spot.
Well, I mean, I think it's been a really great overview. But let me just look at your handout a little bit. Maybe that will give me.
See this, Andrea? It's disco time.
Yay! I am so excited. The first time I met Tanya, I said something about needing to put on my big girl underpants, and she drew me a pair of big girl underpants, and then I knew she was the graphic recorder for me.
So, Andrea, I'm sorry, refresh my memory. What did you ask or invite folks to chat about in the breakout room?
So this one is about the 5 action areas from the Ottawa Charter, and which one do they spend most of their time focusing on?
Right.
Is there one that they could broaden out to? Is there one that they might find most challenging?
So do you think there might be opportunity to invite, we could allow people to unmute themselves?
Yeah.
And if anybody's wanting to reflect on the conversation that they've had, that could be really interesting.
Yeah, I think that would be fantastic. I mean, we still have a fair bit of time. I want to give Tanya a good few minutes to do her sharing of her beautiful artwork, and then there can be time for questions. So yeah, I think that there will be time for that. I keep turning my head because that's where my clock is.
Yeah, I guess that. That you weren't just looking at a parade going by, or
no,
like
that's my clock.
I just noticed my clock behind me is slow, so good thing that I noticed that. Otherwise, I could have got in trouble.
I think it would be great to have reflection time too, in terms of spacing. Like some group reflections would be really nice to capture here.
Great.
Can you see right over to the other side of the board?
Yep, I can. I think you and I have the same chair.
Andrea?
Yes.
Another thing is that thank you for sharing some ideas for a resource giveaway. And we will be giving away a copy of the Health Promotion in Canada.
Yep.
This is one that I picked out of the ones that you sent. So if you do have some thoughts about the book or anything you want to say about it, you'd also be welcome.
Okay. Super.
The sound of markers. We don't hear them now, and we're not getting together in person. Oh, I forgot to pause recording.
So welcome back, everyone. I'm basically done with my slides. And so what I would invite you to do is actually to pin Tanya. And if you like, you can even go to speaker view and full screen so that you can see her beautiful artwork. We're going to have a little bit of time in a few minutes for Tanya to share what it is that she has drawn. And I was saying while you were all in your breakout rooms, it's quite an ego boost to have someone actually writing down the words that you say, and especially in such a beautiful way. But what we thought we would do now is to give you a little bit of time to actually share maybe some of your discussions or some of your reflections. You can also ask questions at this time, but we would really love to hear back from some of you what you talked about in your groups. So if you would like to jot down some words in the chat box or take yourselves off mute and use your voices, we'd love to hear from you what you talked about, how you're reacting with the content, all of that good stuff. I think I will just keep the participant list open here. And if you would like to raise your hand, you can do that. Sydney, I might ask you to remind people how to raise their hands because frankly, I've just forgotten.
Right. So, well, my understanding how I usually do it is you click on participants and that should bring up a participant list. And usually there is a hand raise function at the bottom. But, you know, weirdly, I'm not seeing it on mine. So somebody else had, but what I see is you could do a wave, a hand wave.
No, Sydney,
Oh,
if you can go to reactions, then you can see that. Yeah.
Oh, I see that Lee and some other people have raised hands. So
great.
I'm sorry, who mentioned that they had a clearer description of how to do it?
Should do a reactions as Sunita.
Yeah, then the only challenge is that we can't see that. So let me just go to gallery view and then I can see. Sydney, did you mention there's a couple people with their hands up? Maybe we can start with them.
Yes, and I apologize that I don't have a clear direction. I'll try to figure it out.
It's okay.
But I see that Tammy Lynn has her hand up, so she should be able to unmute. And
hi, Tammy. Feel free to turn your camera on if you like, but you don't have to.
My data isn't, or my network isn't feeling well today, so
no problem.
I'd rather be able to talk. In our group, we talked a lot about strengthening community action, and that this was a real strength for a lot of people. You know, the partnerships are just flourishing. Different organizations hold different specially funded programs and initiatives. And it's just great to see collaboration and action.
Amazing. Thank you so much for sharing that.
Yes, so thanks to people who are helping me with instructions. So if you look for the reactions button on your toolbar and you click on that, you should see raise hand. What's confusing me is because I'm the host, I don't see that function. So feel free to do that. And thanks, Tammy Lynn, for your comment. And if anybody else, do you have time for other comments?
Yes, we actually have a few minutes.
Okay. Anybody else like to just give some reflection on your conversation?
Lee, feel free to choose any reaction you like. Well, we should see them. So if you want to give us a clap or a jazz hands or whatever you like is available to you there. The party symbol is one of my favorites. Feel free to use any reaction, folks, if you don't have the hands up button available to you, and we should see it, hopefully.
Would we though, if everybody's off camera?
Yep. Oh, I see Arlene has the party sign.
Oh my goodness. Thank you. I sure apologize for this. Arlene, do you want to unmute yourself?
Alrighty, I'm unmuted.
Hi.
We didn't have a whole lot of time to talk about things because all of us were kind of confused if there was only supposed to be 3 of us in there and etc.
Okay.
But we did talk about what we were doing. Right now under the health promotion, we're really struggling. We've had some suicides in our area with some of our participants. So a lot of mental health stuff we're trying to work on right now.
Yeah. Is there a particular action area that might support that work other than all of them?
It does take in all of them because
Mm-hmm.
one just feeds into the other, and because we're in an isolated northern community, there's not a lot of mental health things out there. We have all these wonderful numbers to give people, but nowhere for a lot of them are too intimidated by that format. So they really want to come to us because they know us and they are comfortable with us. And
Yeah.
but due to COVID, that isn't always possible. But we've been really trying to, even meet them one-on-one in a large room, and we're just by ourselves, and just to talk to them that way, because that's what helps, right? And what's really unfortunate is because we can't do wakes anymore in our area, and that's so beneficial to the families to be able to have that time to grieve with others. So that's a real a real bummer that we're struggling with.
Yeah, thank you so much for sharing that. We have a couple minutes left and 2 hands up. So we've got Rochelle in the Northeast.
Hi. So
Hi.
I guess that I wanted to share what came through, that we all agreed that we are mostly focusing on creating supportive environments and develop personal skills. We feel like building the relationship with our families is very important. Although, everything else is part of our work. We feel like the foundation is creating a supportive environment and building relationship. And we also discussed, like, not only with the families, but amongst the professionals, right? So bringing in the reorientation of health services, I think, and strengthening community action. I feel like when we have a good collaboration between agencies and professionals, it is felt by the families.
Great, thank you for sharing that.
So that's our conversation in a little paragraph.
That's perfect. Thanks, Rochelle. Northwest Zone.
That's Colleen Jones.
Hi, Colleen.
Hi, everyone. So we had a lively conversation, and just would like to offer the perspective. We also discussed what we felt perhaps was most challenging, and we were talking about public policy and our governments. And, someone offered that if we look to some of our other countries or Scandinavian countries and some of those models, we need to have a vision of how we want our health of our country, of our people, of our children to look, and then how do we build that? We somewhat agreed that we were disappointed in all levels of government around health.
Yeah, thank you for sharing that, Colleen. Tim, you've got your hand up.
Just to sort of echo what Colleen was saying, we were talking about the idea of having vision for Canada. And if you take the 7 generations idea, where it's not about right now, it's about 7 generations down the road. How do you want things to be? And you want everybody to have affordable food, housing, clean water, education paid for. And then how do you get those things done? And really it comes down to policy, changing corporate taxes, cutting out the loopholes for the rich, and really just having vision for the future. And it's, comes down to policy and the way we want the country to be.
Yeah, That's a really great reflection. Thank you, Tim. And B. Serrano, you have your hand up.
Hi.
Hi.
Yeah, we had a chat that focused on, I guess, mostly on the development of personal skills as being a big area that our programs focus on, but also recognizing that the programs do, offer something in each of those 5 actions.
Perfect.
But related to the development of personal skills, we talked about the big piece that our programs offer around food security and ensuring that people have access to food, but also access to learning about nutrition and the importance of food and cooking skills and coming together as a community building, and also as a way of promoting mental health and supportive systems. So, a few people shared about their experiences in their programs. And also another piece that was brought up was how promoting culture in their communities, specifically friendship centers, and their role in promoting and advocating for different issues for their communities, and culture being one of them.
Oh, that's amazing. Oh, so many. I mean, I could talk for about 15 minutes just about what you said, but what I'd really love to do now is give Tanya a chance to share her beautiful artwork to do the wrap up for this session. So again, if you haven't already, given Tanya a little pen and go to speaker view and full screen. Oh my gosh, I'm gonna cry.
Well, thank you so much for inviting me here today. I feel honored to hear the conversation and to hear your discussions and try and capture some of what I've heard. So I'm going to walk us through the chart that I've just created. You saw when we started the session, it was a blank slate, and now it's no longer blank. There's a lot of content that came up and a lot of discussion. So I'm hoping that it's reflective of your experience of the session. So we started with the land acknowledgement, and Andrea talked about her settler privilege, and so that's just recorded in this little area here. Then we asked the question, what is health? And talked a little bit about 3 models of health, and the biomedical model, the behavioral model, and the social environmental model. And the 3 sort of descriptions outside of that, because it's kind of technical, is the absence of disease, choices, and circumstances. So I've just captured that kind of conversation there. Then we talked about the social determinants of health. And what I heard Andrea talking about was the iceberg model. And I hope you can see down here the iceberg that I've drawn, and how that leads into Indigenous health, and having the 3 determinants of health being proximal, intermediate, and structural. We talked a little bit about the Ottawa Charter of Health Promotion and the work of enabling, mediating, and advocating health promotion. So that's this charter. I haven't put words on it in here, but I know that in the slides there were words there that were more accurately describing all of the elements. There were a couple of small group breakouts. The first question that you addressed was what sectors influence health? And the second one were the 5 action areas, which are included over here in the green section, the 5 action areas of the Ottawa Charter. So building healthy public policy, creating supportive environments, strengthening community actions, developing personal skills, and reorienting health services. And before that, we also talked a little bit about, sort of why are we here? Why are we listening to this health promotion session? And there's a couple of reasons that I heard come out, and that is addressing the roots of health. That it's not just about the surface, but really getting down to the roots of health promotion, and demonstrating in your funders' language the CAPC and the CPNP, the work that you're doing in a relatable language. So that's the content area. And then we had some group discussion, and I think it was great that you came up with, you know, strengthening community actions, sharing what you're doing. All actions are important. Collaboration in action, noticing the suicides in communities and the COVID constraints around recognizing and celebrating people's lives and having opportunities for grieving for family members. Creating supportive environments and developing skills were both really strongly associated with the work that you're doing. And then we talked about, somebody mentioned a vision for the future and creating seven generations viewpoint, and talking about the importance of that policy work to integrate with the work that you're doing now, so that in 7 generations, you're having healthier communities. And the biggest policy, public policy being the biggest challenge. And somebody also mentioned that food access was an issue. So this, I hope, sort of lives up to the title for the day. The title for this session was Connecting the Dots. And I'm really hoping that my contribution in drawing for you and in recording for you can help have you take it home to your individual communities and really apply the things that we've been thinking about and talking about today. I want to thank Andrea for inviting me to share with you and to debrief the session, and it's been an honor to participate and to record what I could of the conversation. So thanks so much.
Thank you so much, Tanya. I mean, you just wrapped everything up so beautifully. And one of the comments in the chat box, which I'm sure you can't read, was that you're clearly a very good listener. So I love that comment. And I just want to let folks know that Tanya actually volunteered her time this afternoon to do this recording for us. So thank you so much for your generosity. Can you share with people your website address, Tanya, so people can find you?
Absolutely. So I'm a graphic recorder and a graphic facilitator. So today what I've been demonstrating has been graphic recording, just taking the content and recording for you. But I also do facilitation with numerous organizations, nonprofits, and health promotion folks. And so if you want to find me, you can find me at tanyagerber.com. And my email is at the bottom here. So if you happen to snap a picture of your screen while you're doing it, I'm Tanya at tanyagerber.com. I work with groups and talk about strategy and visioning, talk about how to redesign programming, do team building exercises, that kind of thing. Thanks very much for letting me do that.
Amazing. Thank you so much for... Oh, just incredible to have you. Such a wonderful way. Someone in the comments had said that I'm a visual learner, so this is perfect. So thank you to everyone and to Sydney and organizers for having both Tanya and myself. It has just been so wonderful to be back at a conference and speaking with you and telling you everything I love about health promotion. You can find me on Twitter at Andrea Bodkin, and my email address is on the handout that you would have received. So you are very welcome to contact myself anytime that you have questions. I wish you all the very best. Thank you again for being here. Oh, one last thing, there is a wonderful prize, a really terrific book, the 4th edition of Health Promotion in Canada. And one of the wonderful things about this book is that it spends each chapter talking about something different. So there's a chapter on Indigenous health and a chapter on healthy environments. So there's all kinds of wonderful things to learn from that book. So there's the front cover. So thank you again. I'm going to stop talking, and I hope you all have a wonderful rest of your day.
Andrea, thank you so very much. This was just a really great session all around. I love how you've taken us through that the foundations of health promotion, and in such an engaging way. And Tanya, for your contribution of the visual. I am wondering, Tanya, are you able to take a digital recording of that and email it? Is that something that's possible?
Yes, absolutely.
That would be great. And then I will include that in the archive of the session, so people can have access to it and maybe get a little closer look at it as well. That we'd really appreciate that.
Great.
So, thank you again for joining us, especially on what feels like you know, one of the sunny Friday afternoons that we've had. So it's great for you to be with us. So so I'm going to, as you can see, I've screen shared the book that Andrea has suggested, and we have one copy to give away. And I'm going to call on our prize maven, Sarah, to join us really quickly, and then we will go on a break. But what we thought for this giveaway was that we would do something that we had done similarly before, in that we will ask you to share a reflection. But before you type in the chat, a couple things to remember. Sarah will be the one who determines the winner. Sometimes the order happens differently in different people's chat windows, so it might look a little different to you, but we'll go by Sarah's view. And what we thought would, we're going to ask you to just share a couple of words on what stood out for you today. And it'll be the 10th person who enters that will win a copy of the book. So please feel free to share a comment on what stood out to you. And I can see people have already got lots of things here. So we really have you, Andrea and Tanya, to thank for that. And make sure you post it to everybody. If you send it to me directly, it doesn't, Sarah doesn't see it. So thanks again. Let's see, have you, anybody yet?
Just counting.
Okay.
Every time I get a new message, it brings me back down. So maybe I'll let everybody just kind of get their thoughts out, and then we can announce it after the break.
We'll announce it at the break. And so we will then, you know, you're obviously welcome, both of you, to stick around as long as you're able, Tanya and Andrea. It's been wonderful to meet you, and I hope you have a lovely rest of the day. We have Carrie Moore joining us at 3 o'clock. She's going to do a talk on Indigenous trauma, and I think it's going to be quite something. So feel free, break time if you need to you know, do a body break of some kind. We'll regroup again just before 3 o'clock. Thank you. Take care. Looks like there's lots of comments here.
There is.
If anybody wants to come off camera, have a visit or a chat, feel free to do that as well. Looks like Tanya's leaving the image up there for a while for us, which is really nice.
Amazing. Sydney, what a great way to get people to type in the chat box. I'm totally going to steal that idea.
Prizes.
Sydney, do you want to maybe stop recording just for the break, and then people can pop on and we can all just chat?